The reality of the HIV/AIDS pandemic is that many suffer. Lives are lost. A country's very fabric is compromised. With one of the highest HIV/AIDS rate in the world, South Africa has about 5 million people living with the virus. The country has faced many challenges throughout the years, and the outlook has often appeared bleak. But in recent years, the country has recognized the need to act, and to act quickly. Now, South Africa is held up to be one of the leading lights on the continent in the treatment of the disease. Mother-to-child infections are declining. The population is more aware than ever before about the dangers of unprotected sex. Antiretroviral treatment is in full swing throughout the country. The incidence of HIV and AIDS is slowly declining. Nonetheless, 20 to 25% of the population remains infected, and much still needs to be done. In getting to grips with the pandemic, one of the major stumbling blocks is gathering and recording quality data. Another challenge is making sure this data is available to health workers and other decision makers to assist with important decisions that can save lives. Against this background, the US President's Emergency Plan for AIDS Relief, PEPFAR, initiated the Enhancing Strategic Information, or ESI project, which was funded through the United States Agency for International Development, USAID. This project works to strengthen Southern Africa's HIV and AIDS-related data monitoring and reporting systems. It also aims to scale up the sustainability and quality of HIV and AIDS programs in both the South African Department of Health and the Department of Social Development. In 2010, the PEPFAR program began the transition from an emergency response plan to a sustainable program aimed at helping South Africa to independently manage the program by 2014. ESI covered South Africa, Swaziland and Lesotho. By building skills in strategic information and by providing them with IT solutions, ESI has contributed to reducing the burden of HIV and AIDS in Southern Africa. It is now easier for program managers to access and use information and make informed decisions. The outcomes of the ESI project were presented at a recent conference.
Welcome to you all, and we're really glad to have everybody here for the course of the day. This is a very, very important occasion for us as a project, as you can imagine. I just want to start by acknowledging some people that we have in the room before we start proceedings. We want to extend a special welcome to South African government officials from the Department of Health, Department of Social Development, Public Services and Administration. We do have some members from the police service that are here with us as well. And then a special welcome to the Department of Performance Monitoring and Evaluation of the Presidency.
I think I really want to take an opportunity at the start of this conference to thank everyone in the room, the South African government, the PEPFAR implementing partners, the other development partners that are here, to really thank you for the work that we've accomplished in our partnership over the last few years to take the program where it is.
What we call the service delivery agreements, which are the agreements between interdepartmental work at the government level.
We have to ensure that the public service, meaning all the 46 national government departments and about 94 provincial government departments, are efficient, are effective, and are development-oriented in their response to HIV and AIDS.
But when I saw that really, time was really running out, I said, Treasurer will forgive me. Not after all the good work that ESI has been doing in the country. There's no way I will miss this session.
That as a department, we realized that we cannot only alone be able to can do what we wanted to do, but we needed to develop and enter into different partnerships with the other developmental partners, which of course would share the same objectives with the department, but not coming in with other hidden agendas into the department.
But I think there's a wealth of routine data that is collected on the program. And so oftentimes we don't have the time to truly analyze that information and to really look at what's already been collected and to make those programmatic decisions based on the evidence that really helps answer the questions. Are we allocating the resources to the right regions? Are we doing the right programs in the right area? And really starting to look more at the data to make those decisions.
We started with PEPFAR as a partner looking at the HIV AIDS 911 directory a few years back, and out of that we were able to develop the Children's Services Directory that I alluded to earlier for HIV TB services. And now we have got that OVC Director of Services that look at all OVC services in the country. And we have also been able to look at it from provincial point of view. So each province has a children's directory of services as a result of that support.
I think a big takeaway from this meeting and from other similar meetings like it is that PEPFAR needs to focus on strengthening data quality and strengthening existing systems in South Africa.
Well, the ESI project, of course, had a limited time span, but I think you've done an amazing job within the 5 years that you had been funding for. I very much hope that funding can be found within the donors to continue the project, because I really do think that on a scale, not just in terms of the training for partners, but your work with the Department of Health, your work in aligning between Department of Health and PEPFAR, I think you've done an amazing job. And I really do wish that it can continue if the funding can be found somewhere.
The conference was of value because I find it to be a platform where different government departments can share information with the developmental partners, so that whatever aim that we are striving to achieve, the importance of quality data, we all understand it at the same level.
Because through this conference, we have been able to sit together, and we also, through the curricular development, we have been able to highlight some of the challenges that we have, because we know with ESI we are almost there to succeed. So, and we will also like ESI to be with us until such an extent that we can walk on our own. ESI is still needed for us to be able to benefit from it and transfer the skill that is there in ESI.
Ever since the shortest time that I've been with the department or with the M&E system or in the information system, I've seen and observed, the help or the assistance that was offered by ESI through capacity building courses, through and taking us through to develop a feedback system, reporting system for programs and for other indicators in the DHIS.
The conference was a venue for presenting the successes of the project and show the strong relationship which has developed with South African government departments. In the Northwest Province, ESI worked with health officials to build their capacity to provide information, advice, training and mentorship to improve the quality of data routinely collected. The model successfully changed from being funded by donors to being funded by the government of South Africa, and it has since been adopted in other parts of the country. The training provided by ESI to all levels of staff is ongoing and effective, prioritizing data collection and analysis. With a 56% increase in filled health information positions across the country in recent years, trained staff now support data quality and more efficient data use. ESI also provides technical assistance to improve the data management systems that the South African government uses to track orphans and other children made vulnerable by the epidemic. As a result of the ESI project, the Department of Health now has a policy framework and standard operating procedures that guide how health data is managed. The Department of Social Development has a clearly defined monitoring and evaluation plan for HIV/AIDS. To enable South Africa to continue to counteract HIV and AIDS, together with tuberculosis, it is important that projects like ESI continue and expand. This must include a focus on capacity building, monitoring, strengthening health information systems, and providing valid, reliable, and relevant evidence. The use of geographic information systems to map and highlight critical data patterns needs more widespread adoption by decision makers. Much has been achieved, but much still needs to be done. Successful partnerships like the one between PEPFAR via ESI and the Departments of Health and Social Development are the way forward to beating one of the modern world's most pervasive pandemics.